Hello, Dr. Mark Contos. Welcome to another episode of Ophthalmology Insider. Today I had a chance to sit down and chat with Dr. Allon Barsam, who's been practicing in London, England, and Dr. Eric Mertens, who's practicing in Antwerp, Belgium. We had a chance to have a discussion about how they create a unique practice experience for their patients. Eric, Allon, thanks for joining me today. I appreciate you coming by to talk a little bit. I wanted to talk to you guys both about your practices. You both have very dynamic practices here in Europe, kind of something a little bit different than what you would maybe describe the typical European ophthalmology practice, at least kind of the way I perceive it. And you both have gone a little bit different paths, and I think it's really kind of interesting, and I'd like to kind of delve into that a little bit more in terms of how all that kind of came about. You know, and Eric, I'm going to start with you. Let's talk a little bit about kind of just an overview of your practice, what it's like, and kind of how you made that decision to create a practice that's maybe more centered on the patient experience. There's a little bit of a different, philosophy to the way you practice, and I'm kind of curious as to how that came about.
Yes, indeed. So I started out alone. I was trained mainly in refractive surgery. And of course, when dealing with refractive surgery patients, you want to have that patient experience right. So also on top of that, I do cataract surgery, and there I had to go to the hospital. In the hospital, you have nurses which are dealing with orthopedic patients, gynecology patients, and so on. So they're not only focused on ophthalmology patients. So the patient experience was completely different. So I built a new practice, actually a multidisciplinary practice with dentists and plastic surgeons, all people with the same mindset and attention to the patient experience. So we could build a practice away from all the medical stuff going on. When you enter my practice, it's like entering a hotel lobby, not a clinic. Yeah. People, the receptionists are all dedicated in bringing those patients in, offering them a cup of coffee, maybe a cake or something. So they feel at ease, because when you go to the doctor, you're always a little bit nervous.
Yeah. Yeah. Where did the decision come from, though? Where did that percolate kind of inside you to say, okay, I'm gonna do this? Was there something where you influenced some way by something? Was there somewhere you were at, or something that you saw, or what brought that about?
Well, I was lucky to visit a lot of my colleagues in Europe and in the States as well, and I started thinking like, oh, there is another way to do this. So I started thinking, putting together that multidisciplinary practice, and there was one thing which I misjudged a bit, because I could not manage it on my own, and I was not trained in that. So that's why I also participated in the Vision CEO course this year. It trains me in marketing, it trains me in how to deal with my staff, how to make them happy, how to handle crises when something is going wrong with a patient, how you have to communicate with them, how you can deal with the patients and bring down waiting times. All of that is dealt with in that Vision CEO program, which is over 4 weeks in 1 year.
Yeah. Allon, you're kind of the youngest here of us all, and you're the first, out into practice earlier or most recent. Tell me a little bit about kind of the process for you, because you're kind of doing the same thing. In fact, I was speaking with one of your residents a while back, and they kind of described you as sort of an Americanized English ophthalmologist. And describe that to me a little bit in terms of how you came about those processes.
Well, thanks, Mark. I take that as a compliment, an Americanized
English
ophthalmologist. I was quite lucky that my training was both in the UK and in the US. And I think one of the things that's unique in the US compared to the UK, and probably to some extent other parts of Europe, is just the number of ophthalmologists that are out there. So for example, there are more ophthalmologists in Manhattan than there are in the UK. So in order to be successful, it requires a patient-focused approach. If you don't have a patient-focused approach, patients just won't come to you because they won't be happy. In some places in Europe and in the UK, people have in the past or historically been able to be successful despite not having that, just because there's no one else around. So there's no competition, there's just no one competing with them. And I felt that if I could tap into that kind of success story in the US, if you like, having been trained in a high volume, successful, high technology practice, and bring some of that ethos into the UK, then I would quickly be able to make myself competitive and successful. And so that's what I've done. And I'm kind of lucky that there are, I guess, opportunities, but also challenges for a young consultant or independent ophthalmologist in the current era I mean, the opportunities are that the evolution in technology and the things that we can offer patients are like at no other time. But the challenges are that some of that comes with an economic burden that is, I suppose, difficult to see how someone relatively new into the specialty can actually bring into their practice. But I think industry has recognised that. So, for example, you have mobile platforms on laser cataract surgery happening now, and there are some really kind of high-end, state-of-the-art, patient-focused facilities where you can still protect your own brand as individual. Yeah. And I'm lucky that the facilities I work with do kind of very much see eye to eye with me and the patient experience. So, you know, it's my practice, but not, at the moment, not my facility, because I think that's something that you kind of grow into or evolve into with time.
Yeah, there's kind of a common thread, and I think that common thread is the patient experience. I think both of you have been kind of using that phrase. I've used that phrase, and that's sort of a different way of looking at things than maybe in the past, and probably in Europe maybe more so than the United States. That's not necessarily been the norm, like you said. It's sort of like what the doctor says is the way it is, and that sort of thing. And you guys have both kind of broken from that philosophy, and gone into a different direction in terms of that. Was there much resistance? I mean, did you encounter resistance in your colleagues or in the people that you were working with or anything like that in terms of, you know, what were some of the uphill battles that you had to fight?
Well, I didn't find any kind of resistance because, of course, the team you pick need to have the same mindset as you have. So they already are, and they see how you deal with patients, that you care about patients, and they start caring about patients as well. It's not, and a lot of my patients come in, let's say 1 month after surgery, they bring in chocolates or something, even for my staff. Yeah. And of course they say, wow, it's not only the doctor who counts here, it's only me as a staff member. Yeah. And the recognition is very important. And making a patient happy, there's nothing more cheerful than making a patient happy and coming in, and they bring that message across, not only to you as a doctor, but also to the members, the staff members. And this is something it's a way of working. When you go to other ophthalmologists sitting alone, and you say they're more like in the military. They say what the patient has to do, and the patient has to follow what they prescribe or what they say they have to do. It's the relationship. It's more a flat relationship than an up-down relationship we try to create with our patients.
Yeah. What are your, I mean, how do you see that?
I'm quite lucky that, you know, the other consultants that I work with or who are in practice using the same facility as me are either specialise in something different, so they consider refractive or refractive cataract surgery or corneal surgery to be, you know, my specialty, if you like, and not theirs, so it's just a different specialty. And the ones that do specialise in the same thing that I do are kind of, although they're not the same generation necessarily, but they're kind of equally dynamic, and I think we kind of help to make each other successful. We now kind of cost share on technology purchase, and happy patients do generate a lot of positivity kind of all round, so they will associate you with the facility in which you work if it's not your own owned facility, which kind of generates good positive word of mouth for everyone. So I think that having a doctor in a given practice who is doing well, successful, making their patients happy is something that is kind of good for everyone that's involved in that.
Yeah. What about the surgeons kind of coming up behind you? Both of you have been involved in teaching and with residents and that. Do you see them taking the same path that you took, or do you see them kind of, you know, going in different directions? Or do you see them looking at what you've done and saying, okay, that's something that I want to do when I get out into private practice, or do you see them taking the more traditional route?
Well, it's a mix actually.
Yeah.
Not everybody wants to work like this.
Yeah.
Some wants to work just like a retina specialist. They want to work in a hospital close to the vitreoretinal surgeon. Well, that's fine. But it's how you as a person also like to think and like to be treated, and that is different across the board. And some join me, others they go away and they settle themselves in university hospital or in a general hospital or solo practice. But the problem is, as you already pointed out, Alan, it's a high-tech environment, and this is an economic cost to it. And you cannot be on your own and deliver a high-end technology practice to your patient. You need to join forces so you can have the cost
Yeah.
separated between all the ophthalmologists.
Yeah, I think that's a great point. I mean, it's you need to have a team-orientated approach, basically, and being able to work with other people and find ways that you can basically help each other and things that are mutually beneficial is really key. So, quite a large part of the administrative component, I suppose, of my practice is liaising and dealing with colleagues to try and work out how we can, adopt technology, bring in new technology, keep advancing. I mean, something that we're doing now in 3 years seems completely out of date. So it requires a lot of work and it's continuous. And like Eric said, some of the kind of younger ophthalmologists coming up just might not want that. They might rather just kind of work almost like as an employee, if you like, and leave the innovating and the progression and the driving through of change to other people. But it is a personal choice. I mean, I feel that there's, you bring your own personality to your work as a doctor. Some people are early adopters, other people like to sit back and see something being established for a while, and there's no kind of right or wrong. I don't look at someone else doing something and think, oh, why are they doing that, or why are they not doing that? It's about your own kind of comfort level. At the end of the day, we're all trying to basically do the best that we can for patients, give them the best experience, but you can't separate your personality from that, so it's a question of what you're willing to do, and to set up your own practice, it requires an enormous amount of work and dedication, and not everyone's got that in them.
Ready to do that. Yeah, I think you're right. It really does kind of come from inside, and it's either there or it isn't in a lot of ways, and then things foster that or things quell that. It just depends on kind of the circumstances that you're in. The future going forward, with the demographics being what they are, and obviously we're going to be busier, we're going to be doing more surgery and all that sort of thing. Do you guys look at that as, a lot of opportunity ahead? Do you see things more difficult ahead? What's your general sense of the future for your practice and specifically?
Well, for my practice specifically, I think I need to join forces with other ophthalmologists, other ophthalmologic surgeons, not only anterior segment but also posterior segment. We see a lot of evolution in the retina going on, not only in surgery but also medical retina. So treatment of age-related macular degeneration, which is of course with the elderly population becomes a huge problem. So we need to focus on that as well. And it actually, I think it fits in very well in my practice because you've treated those patients maybe with phaco or with femtosecond laser, you put in a multifocal IOL, and then when they get retinal problems, they can't benefit anymore from that surgery you did. Yeah. So I think we need to create alliances. We have 3 fully equipped surgical theaters in the office. We can do general anesthesia, but it's on this point in time, it's not used as much as I would love to have it.
Yeah. What are your thoughts on that?
Well, I think that the future is bright. I mean, I feel like in refractive surgery, we've only just really scratched the surface. So we'll see an evolution in presbyopia correcting intraocular lenses over the next 10 to 15 years, so that there is an almost perfect solution for presbyopia, which I believe will be an intraocular lens solution. And technology just keeps evolving, and the way I kind of see it is that our work is not really to necessarily compete against each other as ophthalmologists. I don't look at it that way at all. I feel that educating patients out there who don't appreciate or understand the potential benefits of refractive surgery for their kind of visual needs is something that's very important. So, in the UK, the uptake of laser eye surgery, for example, is estimated to be about 3 to 4% of myopes. I'm a myope who had laser eye surgery and found it completely life-changing, as do most of my patients. So, it surprises me that more people don't decide to have it. I mean, it's a financially more viable option than glasses and contact lenses, but it's about educating people, and there's a lot of opportunity. The challenges, I think, is the kind of commercialisation of the specialty. So I don't know how much of this you have in your country, but in the UK there are what we term or consider to be kind of high street chains who will market aggressively, potentially kind of drive down prices, and do not always deliver a high quality service. I think the thing is to actually be confident in yourself and say, well, actually, the things that I want to achieve in my practice are this, and to be confident that you can distinguish yourself and be different. But it is a challenge when it's a kind of highly commercialised environment, because it means, as you were saying, with respect to practice management, you can't just focus on the surgery and even the patient experience or your dialogue with the patient. You actually have to think how the patient is going to find out about you in the first place, or more to the point, not find out about someone else. So there are all those considerations, which is a challenge.
Yeah. Well, it sounds like, there's always, there's differences between the way we practice, but there's a lot of similarities. And it sounds like really as we kind of hear this, there's a lot of kind of commonality between practices in the UK, in Belgium, and the United States that are trying to be, successful delivering a service to the patient that's, premium. And it's interesting to kind of hear your perspectives on all of that, and I appreciate you taking the time to come by and chat. Appreciate it.
Thank you for the invitation, Mark.
Yeah.
Thanks very much, Mark.
Yeah.